tsamaile ra tswelela and Thatogo. I had it was just an oversight on my part. Ka gore ga ke bone sente ke rwala digalase. I could not see Renale Red Tsenolo Mopako being an acting DPS wa project ko Ministry of Local Government. Ke kopa a emele mmone. I had not seen him. That's why nere sa mo introduce ko tsimologong. Me gape Renale Dr. Moses Mengwe. Dr. Moses Mengwe ke director wa Policy Development and Research ko Ministry of Child Welfare and Basic Education. Le ene ka gore ke bone sente ne ke sa mmona. Me jaanong ke mmone. Ladies and gentlemen, I've already indicated to you that it's getting more exciting, and we are going into both WHO and other international blah, 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 blah. So then I have to hand over to the lady. WHO, is the Geneva, Kobo Switzerland, Jalo le Jalo. That's why I'm handing over to the lady. Ladies and gentlemen, a round of applause as we welcome Thatogo to the stage.
Like it's na go go le dumedisa gape. O na o bua gore a bua ka lefoko la bo hot. So now I'll just say this. I think you all know gore why go ne go te thuto ke lesedi. I'll leave you there. Let's conclude the rest. To help us better understand the foundation of this study and also its global significance, we will invite the cluster lead, health promotion, social determinants from WHO, World Health Organization. Let's welcome Mr. Moagi Gaborone to give us light on what is it all about GSHS. Welcome, Mr. Moagi Gaborone.
Ke a leboga motsamaisi tiro. Dumela bagaetsho. Ke dumela gore anybody can be hotter than the minister. But what I like is that her speech actually in many and in very rich ways aligns with what I have to share with you today. The Minister of Child Welfare and Basic Education, who has just departed the room, the Permanent Secretary in the Ministry of Child Welfare and Basic Education, my colleague from UNESCO, Martin Musima, Right Sosebonejo from the Ministry of Health, Baholo botlhela ba gaetso ba le leng teng hano ka maemo a lona ka go tlhatlologana moruti yo re golagantseng le modimo gompieko partners, development partners, representatives of civil society, educators, policy makers, community leaders, youth, and members of the media. Good morning. It is an honor to address you today on a subject, as the minister earlier said, that lies at the very heart of our collective mission, the health and well-being of our young people. I want to speak about the Global School-Based Student Health Survey, GSHS for short, and why it is such a powerful tool for shaping the future of our schools, our societies, and our economies. The GSHS is a collaborative initiative led by the World Health Organization, in partnership with UNESCO, UNICEF, and other partners. It is a low-cost, school-based survey that collects data from students aged 13 to 17 on their health behaviors and protective factors in 10 areas that include diet, physical activity, mental health, substance use, violence, and the home environment, how it impacts their health and well-being. And the presentations that we'll get later on will give us more detail on that. This information is gathered through a standardized, self-administered questionnaire, ensuring comparability across countries and regions. We can all agree that data is the foundation of effective action. Without reliable information, we are left to guess at the challenges our young people face. The GSHS, therefore, provides us with clear evidence that help us shape policies and programs not only in health but across sectors. It enables governments to identify priority issues, whether it be rising tobacco use, poor nutrition, or mental health concerns, and enable the relevant authorities to then design targeted interventions. The information also helps us strengthen school health programs. Botswana has one of the strongest school health programs. And you know, the findings from this survey can, you know, help focus curricula, including counseling services and extracurricular activities, ensuring that education supports both academic and personal development. It also helps promote social development by addressing issues such as bullying, violence, and social isolation. The survey therefore helps us create safer, more inclusive learning environments. It helps us drive economic progress. Healthy students are more likely to succeed academically and transition into productive employment and contribute positively to national growth. Whereas in the opposite direction, poor behaviors or choices in adolescence often lead to costly chronic diseases and social ills in adulthood. In short, the GSHS is not just about health. It is about building resilient societies and sustainable economies. It allows countries to track trends over time, compare their progress with others, and allocate resources where they are most needed. It empowers communities to hold systems accountable and ensures that the voices of young people are heard in shaping their futures. Within the broader school health program, the GSHS acts as a compass. It tells us where we are, highlights where we need to go, and helps us measure how far we have come. It aligns with global efforts to achieve the Sustainable Development Goals, particularly those related to health, education, and inequality. As stakeholders, whether you are a teacher, a policymaker, a parent, or a partner organization, you play a vital role in turning this data into action. The survey gives us the evidence. It is up to us to translate that evidence into healthier schools, stronger communities, and brighter futures. Let us commit to supporting the GSHS, to valuing the insights it provides, and to using those insights to invest in the health and potential of our young people. Because, as the minister said, when our students thrive, our nation thrives. To give you a little bit more detail in terms of the involvement of WHO in the GSHS, we provide leadership and coordination, and we ensure, we provide the global framework and ensure consistency across participating countries. The surveillance also, and we provide guidance in surveillance and monitoring as well. And the WHO Non-Communicable Diseases Surveillance Unit supports the collection, the analysis, and dissemination of country-level risk factor information. This helps nations track behavioral risk factors and protective factors among adolescents. In terms of capacity building, WHO assists ministries of health and education in implementing the survey, training coordinators, and ensuring data quality. WHO also supports countries in providing policy guidance. WHO uses the GSHS data to help countries to set priorities, establish school health programs or strengthen them where they already exist, such as in Botswana, and advocate for resources to address adolescent health challenges. As I said earlier, one advantage that WHO gives to this survey is global comparability. By standardizing the survey, WHO enables international comparisons of youth health behaviors, helping countries learn from one another and measure progress toward global health goals. It also helps in integration into broader health agendas. As I said, the global school-based student health survey looks at issues across board. And this helps WHO and partners integrate youth issues or children issues across strategies that deal with young people across sectors. I wish to conclude by once again emphasizing that WHO's involvement ensures that the GSHS is not just a data collection exercise, but a strategic tool for health, social, and economic development. By guiding countries to use evidence-based insights, WHO helps strengthen school health programs, reduce future disease burdens, and promote healthier, more productive societies. At this juncture, I would also wish to acknowledge the rich role played by our sister agency, UNESCO. UNESCO has played a key role technically, logistically, and also financially. So we need to acknowledge this central role that the UNESCO has played in ensuring that Botswana carries out this survey and brought us to this place today to share the results of the survey. I thank you for your kind attention. Thank you.
Thank you, Mr. Gaborone. I'm going to leave you again to make you think more. Partners, to have a partnership is the heart of progress. He was talking about that we are working with UNESCO, and the previous presenters talked about different ministries that we are working as tripartite. So that's why I'm leaving that message. I'll add on to say that Research is the engine that transforms question into knowledge. And do you have an idea where does knowledge go into? Our actions. Knowledge is action. So let's try to complement the two. So before I go on to call the next speaker, I want to confirm if the people who are from the regions that are with us in this presentation. So can I kindly confirm that? My colleagues, that we are together with them. Are you getting any response? Okay, ma'am. Okay. Without wasting any time, okay, confirmed, they're there. Without wasting any more time, I'll kindly call our principal investigator, Mr. Lesego Udwezi, to share more of insights regarding the study. Let's welcome Mr. Udwezi.
Thank you, Master of Ceremony. I'm happy it's you who's ushering me in. If you may know, I just ask here something. I would say she's a testament to this survey. I was saying she's testament to this survey. As those who were with us during the data collection would remember that she had an accident together with other team members whilst they were coming back from the data collection. So I'm happy that she's here and she's the one who's ushering me in. Ladies and gentlemen, good morning. I would like to recognize the Honorable Minister in her absence, and may you also allow me to write on the protocol so established. Thank you. My name is Lesego Udwezi. I'm from the Ministry of Health under the division called Health Research and Development Division. I'm here as the principal investigator or the survey coordinator of the study called Global School-Based Student Health Survey. I'm not alone, as I was introduced with Mr. Nkutsi. Together we are the coordinators of this survey that has brought us here. This is indeed an effort from the tripartite ministries, as was shared, the Ministry of Child Welfare and Basic Education, Ministry of Health, Ministry of Local Government, together with our partners. We'll be here to mainly share the results of the survey, and this is my background. I hope those who are joining us live can also see the slides as they move. Before maybe I go any far. Mr. Gengeja, they can see the slides, right?
Yes, we can.
Okay, thank you so much. This is the background, which, or the outline, let me put it that way. The background has been shared by Mr. Abaroni. I'll go on to the purpose, objectives, the methodology, and finally the results. And then I'll conclude and recommend and get to acknowledge the teams. As I said, this is a collaborative survey conducted by the three ministries with the support of WHO and UNESCO. WHO, they came up with the tool, and they also assisted in doing the data analysis. This tool was pre-tested in Brazil, China, Venezuela, and closer to home, Zambia. and it was also revised in 2012, 2017, and 2021. The study itself was done in September 2024. We had the chance of validating the data, and then we are here now to share the results. I would also like you to note that the last survey was done in Botswana in 2005. Our survey measures the following: alcohol use, dietary behaviors, drug use, hygiene, mental health, physical activity, protective factors, sexual behaviors, tobacco use, violence, and unintentional injury. We had a chance of dropping some of them, but we decided to go with all 10. We had a chance of getting 6 or more, so we decided to take every module that was available. The purpose has been shared as well. It's mainly to help us develop priorities, establish programs, and advocate for resources for school health and youth health programs and policies using that accurate data that we would have collected during the survey. It also allows for international agencies, countries and others to make comparison across countries. It also helps establish trends and the prevalence of health behaviors and protective factors by country for use in the evaluation of school health and youth health promotion. Mr. Gaborone was saying it provides us with a compass and a way of us, knowing where we are going. So this is the purpose, and these are the specific objectives: to understand first the status of adolescents' health in Botswana, and to generate data that will be used to improve health of adolescents in our country, and even establish trends, as I've been saying. Now to our methodology. This is a cross-sectional study. It used a two-stage cluster sampling approach, which is representative of all students aged 13 to 17 years. In the first stage, 34 secondary schools were selected with probability proportional to enrollment size. This is to say we provided WHO with data that comprise of the names of schools and even the enrollments of all classes that have our 13 to 17-year-olds, which is mainly Form 1 up to Form 5. And in the second stage, classes were randomly selected, and in each class, whenever the child has a parental consent and was also able to sign an assent, they would be allowed to participate, despite the fact that they may be out of the age range. So we ended up with 2,485 students participating, and the expected number that we wanted was 3,977. Hence, we got the response rate of 62.5%. Otherwise, the school response rate was 100%. We were able to reach each and every school that was sampled. Now to the results themselves. I'll start off with the students' demographics. We had 1,041 males. Females, there were 1,432. And we had about 12 who did not state whether they were male or female. And most of them, you may realize that they are in our Form 1 to Form 3 classes. Now to their ages, as I said, whoever was in a class was eligible. Whichever class was selected, you are eligible. Even that would mean that even those who are 12 or younger were also participated, let me put it that way. We had 19 who were 12 or younger. 13 to 15, there were 1,370. 16 to 17, 859, and we had some who were older than the 18, who were 18 or older, and there were 233. We also had some who did not indicate their age. Remember, in a research, you are also allowed to respond to any question that you feel comfortable with. So we encourage them to be comfortable, more so that they were not writing their names or even writing the name of their schools. We, tried them get them to just relax and give us the information on what they know and know to be happening around them. Now to the next variable, which is nutritional status. We have nutritional status, or the one on underweight. We realized that we had more males who are underweight at 15.9%. In this case, we took their heights, we weighed them, and then they registered or responded on an answer sheet indicating their weight and the height, and then this was measured to give us the BMI. Hence, we have those who are underweight being males at 15.9%. On average, underweight was 10.3%. On overweight, we had females who are overweight at 19.4%, males coming in at 9.9%, and on average, they were at 14.9%. Obesity, on average, we had 4.2% obesity or obese, and most of them were females at 5.4%. On the frequency of drinking carbonated soft drinks, we had 16.9% who said they did not have any carbonated soft drinks in the last 7 days of the survey. So it means the rest, who are around 80 or so percent, had carbonated soft drinks in the frequencies that are stated there. On the frequency of drinking sugar-sweetened drinks, those who did not, or those who indicated that they did not have any sugar-sweetened drinks, they were 31.8%, and most of them had the sugar-sweetened drinks. And in our questionnaire, we even wrote Booro so and the like so that they can, understand. The frequency of eating fruits, we had 32% saying they've not had a fruit in the last 7 days before the survey. And the rest, they have, had some in those frequencies. And as the frequencies, go up, you realize that their numbers are going down. On frequency of eating vegetables, those who did not eat any vegetable, they're at 16.15%. In others, as you can see, their frequencies, also decrease as the number of frequency increases. Those students who were physically attacked in the last 12 months before the survey, in this case, you realize that those who have not had any physical attack in both males and among both males and females is around 64.8 for males, 72.7% for females, and then the rest have had, those physical attacks in the frequencies as stated. Here now we are able to compare 2005 to 2024. You realize that in 2005 we had more students being physically attacked in the last 12 months, which means that the physical attacks are more prevalent in our junior secondary schools, according to the statistics. Those who are engaged in physical fights in the last 12 months, you realize that it's mainly boys who are engaged in physical fights. And in comparison, most students who had physical fights were recorded in 2005 when compared to 2004, our recent survey study. Those who were bullied in and out of school in the last 12 months, we had more bullying occurring in our schools at 33.5%, and out of school is 21.9%. This one we could not compare because it was not there in the 2005 instrument, of which 37.5% of those bullied in school premises were girls. Those who were cyber-bullied in the last 12 months, those who said yes, they're at 14.3%, which means cyberbullying is prevalent in our schools. And according to their experiences, most cases of cyberbullying were through nasty or hateful messages, pictures or videos which were shared or posted online. Now to another variable on tobacco use. age to which students first tried smoking a cigarette. Those who have never tried, they're at 76.1%, and others, as we can see, 4.6% of our students first tried smoking from 9 years or younger. By gender, 5.1% were boys. On consumption of alcohol by age, those who have never consumed, they're at 47.6%. It means the other remaining percentage is those who have tried. And it's more than half of those who have indicated they have had their first sip of alcohol from 7 years. And if you disaggregate them by gender, it reveals that 54.9% of boys had their first sip of alcohol from age 7 years. 27.3% reported having had one drink containing alcohol in 2024 compared to 2025, which was 20.6%. The students who are first drug use by age, those who have never tried, it's at 89.3%. It means the rest, who amount to 10.7%, had their first drug use from 7 years, of which 1.4 were younger than the 7 years. Further disaggregation show that male students at 15.5% had their first drug use from the age of 7. Still on drug use, the percentage reporting the ease of getting drugs for non-medical purposes, it's at 7.9%. On whether they were asked and whether they've seen any advertisement that is against drug use, only 27.7% said yes, they've seen some sort of advertisement, they've read or heard something that tries to discourage them from using drugs. Students who were sexually abused in the last 12 months, overall 16.2% of students revealed that they were sexually forced to do things that they did not want. Further disaggregation by gender shows that 19.7% of those abused were female students. On the age of sexual debut, about 82.9% were saying they have never had sexual intercourse, which means the rest, which is around 17.1% of our students, had their first sexual intercourse experience younger than 11 years and above. Further disaggregation by gender shows that 22.2% of the boys reported sexual debut at an early age, of which 6.1% were younger, or 11 years or younger. On contraceptive use, 6.2% of our students did not use a condom during their last sexual encounter. And when you disaggregate by age, 13 to 15, and gender, 6.8% were boys and 2.9% girls did not use a condom. And it also seems condom is the most used contraceptive method among our students. On whether they experience depression in the last 12 months, more than 70% of our students indicated that they had experienced depression. And further disaggregation by gender shows that 76% of those who are experiencing depression are females. Still on mental health, though the percentage of students seriously considered attempting suicide, if you compare the two surveys, there isn't that much of a difference. So further disaggregation shows that most suicide plans were made by female students at 28.2% in 2024. Students who attempted suicide in the past 12 months, 116 students reported having attempted suicide more than 4 times in the last 12 months of the survey. Further disaggregation by age indicates that a student less than 12 years attempted suicide. On whether they were taught how to manage anger and handle stress in a healthy way, more than half of our students decried never attending a class on how to handle stress in a healthy way. On hygiene or oral hygiene, those who cleaned or brushed their teeth 1 or more times per day before the survey, you'd see here that at least we are doing better. We are around 93.9 and, you know, around 98, 96 and 98.5%. Those who cleaned or brushed their teeth using fluoride, the percentage sort of went down. We're not sure here whether it was because of lack of understanding of what fluoride is or not, but otherwise that is the percentage. However, we also had 7.5% who missed classes or school because of problem with their mouth, teeth, or gums. Maybe it's to do with the fact that they may not be using any fluoride or using toothpaste that does not have any fluoride. Hand hygiene, those who never or rarely wash their hands before eating. Here we have males at 6.8% and females at 5.8%. On whether they never or rarely wash their hands after using the toilet, males are leading at 7.7% and females at 6.5%. Now on physical activity, percentage of those who are not physically active for a total of at least 1 hour per day on all 7 days before the survey, on average is 81.2%. You had girls leading 82.8%. Those who did not go to physical education class, 65.5%, with girls at 69.1%. Percentage of students who spend 3 or more hours per day sitting or lying down when they are not in school or doing homework or sleeping at night during a typical or usual day is at 55.7%, and girls at 59.1%. Maybe this translates to the fact that they are obese and they are overweight and and the like. Percentage of students who get less than 8 hours of sleep on average school night is at 60.9%. Percentage reporting that their parents or guardians most of the time or always understood their problems is at 42.4%. And when we compare 2005 and 2024 among students or those who are reporting that their parents or guardians rarely knew what they were doing in their free time, 55.7% were saying their parents do not know what they are doing with their spare time or their free time, whereas 34.0% reported that their parents never or rarely knew what they were doing in 2024. Now, in conclusion, the survey offers a detailed and thorough picture of the behavioral and health hazard that our adolescents aged 13 to 17 encounter. It also highlights that alcohol use, mental health issues, physical inactivity, nutrition-related problems, violence, and bullying are among the major challenges. It also indicates that there is weak protective factors such as lack of parental support. It also indicates the usefulness of GSHS in producing useful data to support safer learning environment, boost school health programs, enhance nutrition and physical activity initiatives, and improve counseling and mental health services. And in order to protect the development and well-being of young people in Botswana, as was said right from our Deputy Director to the Minister and even Mr. Gaboroni, that it's a necessity for us to integrate and use the evidence-based interventions across schools, families, and communities for us to see, our children strive in that regard. Now I'm going to the recommendations for future studies or research. It's clear that we need the survey each and every day so that we can clearly see the trends There's also a suggestion that we expand the tool a bit to add dietary patterns. I believe there will be, other suggestions that will come that will add if we would have the chance to do another survey. The recommendations specific to the study objectives is clear that there is a need to improve the current school feeding program to cater to the nutritional needs of our learners. There is need for enhanced nutritional school food environments by collaborating with relevant stakeholders to improve the availability of healthy food options in and around school premises. There is a need to strengthen and intensify educational awareness on drug and alcohol abuse. There's a need for enforcement of alcohol, tobacco, and drug regulations, which is a collaborative effort between schools, parents, communities, law enforcement offices, retailers, and other stakeholders to prevent consumption by minors. There's also a need to strengthen initiatives that promote good hygiene practices by improving access to facilities and strengthening hygiene education, and to also enhance routine mental health screenings, assessment, psychosocial support, and referrals for those who are struggling and those at risk. We also need to resuscitate PACT and also ensure that comprehensive sexual education should be strengthened to ensure effective and efficient empowerment of our learners. We need also to resuscitate school health structures at all levels, which include, among others, local school health committees, and empower structures such as parents and teacher associations to even to intensify school-based interventions such as anti-bullying and anti-violence intervention to arm students with the necessary tools to protect themselves. I would like to also end by acknowledging WHO, UNESCO, the tripartite ministries for agreeing us to take part in the survey, and even the smaller team, the technical working group, the steering committee members who are coming from other NGOs who are helping us, coming up with the names that are specific that, our children were able to know and, refer to when they look at the tool. We also had district school health focal persons who are joining us from the district. They were also assisting us with, taking the consent papers to, different schools. They are ensuring that whenever the team comes, parents have seen parental consent and were able to sign for their children. We also had regional officers who are also part of our team. To the teachers who are also able to, usher us into their classes and also introducing us to the students. Last but not least, to our participants who are students who took their time in responding to the many questions that you had, we would like to thank you. Thank you, everyone.
Thank you, Mr. Udweze. What we measure through GSH is more than data. It's a reflection of health, safety, and hopes. Hopes of who? He was talking about the 13 to the 70-year-olds. So I'm actually talking about the hopes of those. We know our future depends on them. So my partner is here now. We are complimenting each other. Onanzaza malowani and I'll be alone. So give me the remote. We are together now.
Ladies and gentlemen, the next item on the agenda pertains to discussions that should take place. Actually, what that means is you may have some questions, you may have some areas where you wish for clarity from the presenters, So this is the opportunity. You put up your hand, tabo re go bona, re rolile galase ro theka bobedi gore bonle ba ko morago. Then you say whoever you are, your name, and the organization you represent, and then you say your question or you make your comment. We have two people who have a roving mic. Once we point at you, they will locate you, give you the mic, and speak audibly.
One more thing, let's note that all voices contribute to the solution.
Look, there's a hand there. Yeah. Just together. Yeah.
To give me this opportunity to also add something. Mine is not a question per se, because I really appreciate this effort, our ministers, go ta gore update ka dikgang tsa bana ba rona. Ke dumela gore rota ka re le we are all aware that our children needs holistic protection. Ka di tseng ka teng. Me concerning issues that are surrounding our children, hona di tse dingwe tse re di overlookang ge re ntse re bua ka tlhokomelo ya bana ba rona bogolo yaka re supa their pass rates le dikgang tse dingwe. Ne ke re ke yana ka bokhutshwane ke sa atheke ope kana sepe. Kire, what I have observed as a parent, as a father, especially when our kids are about to write their final exams, either standard 7th, Form 3s, Form 5. Kidumela gore ba gaitso gore o kgone kana gore ngwana a passe ke gore a ba ithuta. But what I have observed in nako tse dintsi re le botsadi ro theka ka karetso gantsi ha bana ba le gaufi le go kwala tana ditumelo a gore going to church ra go ba nwenta ba tla pasa mme go mong ke dumela gore re go dirile nako tse ding for quite a long time mme go sa re maduo. I can give an example. Bana ha go tebe go rapelelwa from my house up to the church ha ke itse go dire halala ngwana gone ho. From the church up to kolapeng le gone ha ke itse go dire halaeng. So se ke le ka go heta ka sone gore batsadi, let's focus le ko dikerekeng gore go ngo go nna le mogopolo a gore ke ne ka bona kerekeng mo ko kopong. PPS. Every Saturday, that church is the little Hajaware. Bakope Matisara ba Rute Bana on a Saturday. Honanobo Bakalabalo Kereke in the whole day, Basai Tute. You cannot pass Osa Labana the book of Sai Tuta or Talonso or Pella the whole day. More you want Rotain Salabachadi. Kidi cancer overlook because of certain religions. Mo go le gone kwa re heletsa bana nna di ashara re ba tsnya mo di praise and worship teams ga bana nako ya go bala, especially tsone di nako tseo mo e leng gore ke tsa dilo tse ha re ka kopa ba ruti le dikereke ka bophara re sa ba ntshe kana re ba tsone dikereke ra le ka o seletsa bana ba rona gore ba nne le bokamoso jo bo apegileng ya ka bitso le dikgadi dintsi ba gaetso tse di tswang a ke kwa di bareng ke kwa dikerekeng tse tsa go dirisa bana botlhaso ba banyenyane ke tsao se tse di ama mongwe le mongwe batsadi ra itse. So it's time now gore le mekano batsadi go khudumela all sectors sengwe le sengwe se di itse gore ngwana o heta go sone re bone gore se letsa ngwana re batla bana ba rona nna bana ba ba golang ba sena dilabe. I forgot to introduce myself. That talk ceremony.
E o ka tswala ka introduction.
Era ke bidwa Re Nteba Erismauto. I'm a school health program coordinator for the new district Mogoditsane Tamaha District Council.
Thank you very
Ke
much.
o kametse khotla la banano ke kopa me tona batsadi gore a re kodi meleng go bana ba rona ba tsamaelang te di khadi dintsi ha ke pasele ba ruti ke tsa le bone da fula we
Nya
o
ba
bona di khamo metsweding. Thank you very much batsadi.
Thank you very much. A round of applause. Gona le ka kwa ga gona le tsogo. Please also our technical teams help us le ba our online participants. Le bona ga ba le teng, we should include them. Me hana ro se tsa tshutse mic. Ne ke le ke checka ka ha pele ka ga gore ba siame ka ha. Imma.
Audible?
You are
Okay, is it allowable to sit?
or to stand.
Okay, I'll stand then.
Yes.
Okay. Dumelang bagaetsho gape ke bidwa Dr. Perle Fadola from the University of Botswana. I'm representing Botswana Educational Research Association, which is the child of Minister of Child Welfare and Basic Education being hosted at the University of Botswana. I'm also the chief editor for Mosedidi Journal, which is the journal for BERA or Botswana Educational Research Association. Basically, I would just ask questions for clarification from the just reported study or the findings that were just reported. One of my questions is what do the Botswana results portray, or what is it that they show when we compare them to other countries within the region? Because this is like a global study and we're using the indicators in other countries or globally are also used. How do we level Botswana and compare Botswana to other countries within the region and globally? That is the first question. And my next question would be, the presenter indicated the indicators they have improved, and my question is, what are the contributive vectors to the improvements, or what are the contributive vectors to those? My next question would be, what are the gaps or the limitations that were identified that can then maybe inform kaharetsang kana re collectang data in the next cycle? Motsamai tiro ga ke itse gore di question go letlelwa tse
Go letelwa tse pedi di ka nna tharo if you are fast like me.
Okay, ke tla leka gore ke tse ya bohelo because I'm also a specialist in the area of food and nutrition. Then I would reflect on the one for nutrition. The findings do indicate that the matata are overweight, obesity and overweight as well as undernutrition. So with regards to that, what are the plans or interventions that are in place that can then mitigate against those issues? And also, how is the school environment like in supporting the nutrition of children? Thank you very much.
Thank you very much. There's another hand there. Oh, let me do this. There's you. There is a Hona le mangape. Hona le kumorago kwa le meha. Le wena o tabolwa bohelo for this round. Then for the next round, ke bone gore matsogo a mangwe for the second and last round. Hona le matsogo a mangwe ka kwa re tataratseng. Let's proceed with these ones. Two quick questions. O ka nna phela boraro if you are fast like me. If not, just 2 or 1.
Thank you very much, Mr. Setiro. Limpimo from IDM. IDM stands for Institutes of Development Management. I want to thank the PI for the study. One quick question was, I also had a question about the comparisons to the countries. So it is also asked. The other question that I wanted to ask is about disaggregation of data according to the school types. We do have different types of schools in this country. We have boarding and non-boarding schools. We have unified schools and non-unified schools. So I wanted to see the picture in terms of the types of the schools, what is happening within the unified schools and what is happening within the boarding schools and non-boarding schools. So that's the question that I want to ask to the PI. And the last question is about to the partners, WHO and UNESCO. We were once engaged in sort of trying to come up with a plan to implement what they called the global standards for health promoting schools. And what I'm seeing here is basically what we found out as we were doing that project. So one of the recommendations from this survey could be the implementation of those global standards for health promoting schools. The global standard for health promoting schools, basically there are 8, but most of the findings here, they cut across all those standards. The researchers could liaise with the partners here to get the reports of what we found out and try to sort of fast track the implementation of those lower standards. They would actually address some of the findings that we have found here today.
Thank you. The other hand, or the hand is no longer there.
Good morning, everyone. My name is Alpha. I'm from a company called two questions here. Actually, I need to, I'm seeking clarification on the numbers presented. The first one goes to suicide attempts. The numbers were given, but the reasons behind that were not supplied. So if kindly, if that is possible and not harmful to the emotions, can we please be given the reasons behind that? Lastly, the one regarding to the brushing of teeth. Can you kindly give us the figures in regard to the areas? Because like say one speaker was saying, if we had to be given like breakdowns of statistics. Thank you.
Thank you very much. I think I also need to indicate that colleagues from the media, if you wish for a more detailed interview, we will allow that opportunity towards the end, but you are still free to ask whatever quick question you may wish to ask now. But the presenters here will be available to respond to any questions you may have. Where's the other hand? Let's finish with this. This side we are done. The last one will be him for this round.
Good morning. My name is Kimunilo Bunno. I am a teacher at Dissemination Senior Secondary School. Main comments, I'd like to comment on the dietary, the recommendation from your study. You're talking about taking care of the diet of the kids. And I was thinking of the staff from where I work. I've been working with the staff for 15 years. I don't remember them getting trained on any dietary needs for kids. So I think the recommendation should include the training, the habitual training of those people who deal with the food. Because, for example, the kids right now, most of them eat fat cakes from the tuck shop, from outside. They don't want to eat the food from the kitchen. And I think we will know that kids change as the generations come, the groups, the different groups, they all want different things. And if the food stays the same, it means that it's not going to interest them. And maybe that's why we have so many issues of the issues mentioned in the study. I also like the one about clubs, the PACT and the other clubs. And I really feel that clubs should be there in schools. Since the COVID, all the clubs stopped functioning. Only a few clubs are working, and it is my understanding and my experience as somebody who works very closely with kids in school. I know that when they are not engaged, they will find ways to entertain themselves, and most of the time, the ways that they come up with, they are not good at all. So I think we should try and make sure that the Ministry of Education help however it can to return the labs to schools, to encourage that our schools have activities which can engage kids and protect them from doing things that are harmful to themselves. Thank you.
Thank you very much. The last one will be the gentleman.
Thank you, Mr. Tiro. Ke bidiwa Thabo Katlholo from the Anti-Tobacco Network. Society organization based at the University of Botswana, and we are currently on the ground in different communities in Botswana. And the one thing that I would like to highlight about this study is that we are happy with the inclusion of e-cigarettes and other nicotine delivery systems, they are not conventional. But the situation has changed. You remember that in the 1950s and 70s, the cigarette is the one menthol. That was the new era of tobacco. The era of vaping and e-cigarettes. And right now in the country, we have a serious issue of nicotine addiction. Nicotine has become the gateway to everything. Marijuana, methamphetamine. But from that one single cigarette, which was nicotine. So my question and intervention would be, has there been any assessment in terms of because one of the situations that we are facing right now, we have a long list. They come, they are addicted. They are addicted to tobacco. They want to quit. But there is no assistance. There is no clinic, there is no hospital that assists anyone. Anti-tobacco, other NGOs, because the working modalities are not really functional. So we'd like to know, are there any cessation questions in the study in terms of if they are not, is there any future plans for their inclusion in the next GSHS study?
Thank you very much. So I would like to call the Principal Investigator, Mr. Uduetse, to add more Momafukong a Khotla. You're welcome, Mr. Uduetse. Come on board. Let's clap hands for him. Something, let's kindly welcome Mr. Gaborone to have 2 or 3 words. Thank you, Mr. Gaborone.
Thank you. I just wanted to, I think, explain that what you saw is essentially a summary of the findings. You can imagine we're dealing with 10 different issues. So there was only so much that we could be put into a presentation for this. Just as an example, for instance, around drug use. You saw, I think, response to 3 or so questions that were asked relating to that. But there were questions, for instance, about how do they access these drugs? Do they send somebody to go and buy for them? Or do people come to them, Baba Reiki sets about how they can advertise these and Baba Reiki sets and those sorts of things. So under each category of those 10 issues, we chose questions that we felt would sort of help us appreciate what the situation is. But as you know, the minister alluded to, and also in my intervention sort of mentioned, is that this sort of gives us where we are, what are the issues in our schools. Then researchers like my sister from the university or anywhere can then do qualitative studies that will tell them, you know, how all these are really now impacting the lives of young people and that sort of. So it's an opportunity to further, you know, unravel what this study is saying. So I just wanted you to appreciate that, you know, he may not necessarily be able to give you some of the answers you expect because of the nature of the study, but also because you know, they really just picked, you know, some questions out of maybe an area that had a key question and maybe 4 or 5 follow-up questions. I just wanted to clarify that this is really a summary of or summed up version of what the issues are. The tables, the data tables are available for further, you know, what do you call? Further examination and for further, you know, extraction of some of the information that may be there. And I guess it will be up to the ministries that own this data, the 3 ministries, when and how they'll avail those tables, data tables, for further examination by, you know, researchers and any others who may want further information from that. Thank you.
Thank you, Mr. Gaborone. Mr. Gaborone was kindly reminding you that research is a school of thought. You do what you do now, and it branches to further investigations. You cannot answer everything at the same time, but you can go further and investigate. Mr. Udwetsi, you can come and add up on what Mr. Gaborone has said already.
Thank you so much, Director of Ceremonies, and thank you, Mr. Gaborone. You have really, you know, assisted me. Yeah, I would just like to be honest. But otherwise, as he said, this was a qualitative survey, quantitative, I mean to say. So it means if you need more information, need more, you know, our data is available. We can use it as a baseline for you to get to know what is really happening in our schools. There was also a question on comparison with other countries. What I can say is that we did not do any comparison because this is just, you know, the preliminary results. So for you to be able to, you know, have or compare with other countries, they need to be also be published in the GSHS website. That is where you can get them. And for now, I don't think there are many countries that have done that. I'm just not sure for now But if you need to compare, just go to the GSH's website. You will get those summary tables, and you'll be able to compare. On issues of interventions, it has been said, it's up to the ministries, it's up to individual organizations that are, are capacitated to intervene. There are also other positive comments on, the use of harmful food. That is things that we can also try and include in the next survey, if ever we'll be part of the team. Reasons mentioned for suicide attempts, that is qualitative. It can also be, analyzed further in that regard. There was also another question on cessation studies. Let me just say that there is another study that has been done on global youth tobacco survey. These results are also out, which I believe you'll also be able to access. I think there are also questions on cessation and the reasons why they want to maybe cease or stop the use of tobacco. Yes, there was another one on boarding and non-boarding schools and unified schools. The thing is that what you have here is just a representative of what is happening in our schools. So the survey itself does not allow us to go deeper into which school, which student, and the like. So for now, it's just a basic summary that you can use, if you want to dig deeper. I would put it like that. I believe I've covered most questions, and Mr. Gaborone has also indeed assisted in that regard. Thank you very much.
Thank you very much. I can't remember that we have some officers who are online, so we'd like them to give them a floor now if there is any of them who need some clarity on today's discussion. Hello? Maluleke, any questions? Jones, do you have any questions regarding the matter which was discussed today? Matema? I guess there are no further questions. May we proceed? Without more questions. Okay. Oh, there is one more member on the floor who would like to ask a question. Okay.
Thank you. Thank you, Directors of Ceremonies. I'm not actually asking a question, but as a part of the technical working team, maybe just to add on to the responses to the questions.
Okay.
Thank you. I am Esalona Khopana, and I'm from the Ministry of Child Welfare and Basic Education. And mine was just to put an addition to the responses which have been made to the questions and comments that have been brought forward, just to alleviate some of the concerns. I wish to share that I'll be specific to those ones on school feeding and nutrition. Let me just highlight to the house that the ministry has 2 new units. I don't want to call them departments, but new units, which are focusing on the nutrition of our schools. We have the care and support for learning, for teaching and learning. That's a new unit that's going to be responsible for just the care and support for teaching and learning. And we also have another one which is also looking at homegrown feeding and nutrition. I believe these are the 2 developments that we're going to be having, which will be zeroing into our school feeding to ensure the health and nutrition of our learners. And another one that came up was on the school tuck shops. And I think that one we wouldn't really go zero into, because honestly, when we have our kitchens are the ones which are responsible for feeding our learners, and within our school environments, let's see how we deal with our school tuck shops. Maybe we can also benchmark on how other school institutions are taking it up. I just wanted to highlight that we have these 2 units that are going to be looking into nutrition at Saron. Thank you very much.
Thank you very much, Makopana. Any questions? Okay, there's one more here. From here, then we'll, the last 2 there.
Ceremonies. Give it Dr. Moses Meng, a teacher by that my ministry have deliberately taken such a move. The most important thing, research, you start with a simple question. Is there any problem? From the results, all of us here, we have seen isn't it? That's the most important thing here, research. The first thing that you do is there any problem? If you look at the 10 variables, they were purposeful, and they've since shown us, yes, indeed, a problem. I started off by question. I was once a student. Ultimately, I worked in a school, and currently I'm at the Ministry for Policy. So when they were presenting, I was like putting myself at the center as that small boy who was running around my Tengwe primary school. And I was saying, hey, how old was I? I went to school when I was 8. Up to standard 7, I had never tested Bujalo, never tested Mutsugu. But when they were presenting here, I was like, who? Those who are younger than me, before I went to school, have already started doing something that they shouldn't be doing. What are we saying? Where are we going in terms of policy? Secondly, I was impressed about the type of questions and comments that everybody here was posing. You know, at times we ask questions not because we demand answers. We pose questions because we want more research to be done so that each and every individual can understand where we are going. You know, one of the researchers, philosophers, once said, the most important thing is not to stop questioning. So I'm saying here, let us not stop questioning. And the more we ask, the better for our society. To the team, I would say, well done. I'm impressed. And don't take the challenges or the questions or comments to be anything that is challenging you as those who were conducting the research. But instead, these are questions that we need to ask ourselves. And these are questions which should lead us into future research. What should we do ka our schools? I was quite impressed ka mungo karuna yone ngabwa hurapella bana. Yes, I was quite impressed. You know, at times I'm a parent. Bongwana ke ba heditse sekolo. Mme ke na le bana ba bana. Ha ke re, I'm asking myself, had I not gone to school, and be empowered ka thuto. What could be I do? What could I be doing ka bana ba bana? Would I go to church and say barapelwe, or would I sit down with bana ba bana and say this is the right way to go? This is a pertinent issue that we should be looking at. You know, at times when we do qualitative, we do it in so much that we prove to say, yes, there is a problem. Out of it, what do? We go further into research to say, what is the root cause and what could be done? Thank you.
Thank you very much, Dr. Mengwe. Ki itumela gore there is a Sona proverb, it starts off the toto, dia, basically it talks about that we build progress together. So basically that was Mr. Mengwe was saying, Dr. Mengwe was saying. Another question from there?
Thank you. I have small questions leading to one question. I am Bishop Oponto, Policy Coordinator. My question is, first I would appreciate the study. My concern is the study focused on the school-going children, but we have other children of the same age group not going to school. So I was wondering if there is ever, or there's ever going to be another study that is going to focus on those who are not school going, because as you were saying, and even from the minister's speech, they talked about, everybody here talked about the children being the future of the country. I don't think we are only relying on those ones going to school. Something has to be done to attend to those who are not going to school. Like I said, I am from Botswana Prison Service. Already we have about 200 kids at Moshopa Prison. So I am just wondering if we don't take them as the future of our country. We have not studied those at the prison, so we don't know what is happening to them or how their future looks like, or we've just given up on them because they are in prison. And my last question will be the one when we talked about the physical violence and the like. So I'm just wondering who are the perpetrators to those school-going kids? When they're being physically attacked out of school, are they being attacked by their fellow schoolmates, or the perpetrators are just older people out there, or the perpetrators are the ones that we already have in Moshopa Prison? Thank you.
Thank you very much for the question. The beauty of research is you focus on one thing, the branches that I come upon, you go and investigate further on the matter. Thank you for the point, ma'am. Another person?
Thank you so much. No, this is a response to the question which came as to what are the responses to the rising cases of obesity amongst our school-going children. So I'm from Ministry of Health, and I just wanted to respond saying that the Ministry of Health is currently developing our first ever food and nutrition policy, which is in collaboration with most sectors, even the sectors that are represented here. And in the policy, we do have strategies that are zoning in to curb all forms of malnutrition, inclusive of obesity, in our school-going children. And one of them, I think, has been touched on, which is strengthening our homegrown school feeding program. And then we also have a proposal to regulate the school environment within and also surrounding the schools, and also to strengthen the implementation of physical education and also sports in our schools, and also social behavior change. This one I'll also zone it quite heavily into it, because that really, when you look at obesity, the drivers of obesity are vast. And we also need to take responsibility as parents, as communities, as to what our children are being fed. Because the schools can feed the right things, but then who gives money to the children for them to buy momaguinya and all other things? It also starts in from us as parents. So I think we should also look at ourselves as parents, as communities, as to what our contribution is towards the drive of obesity in our children.
Thank. We note every voice and every idea. I'll call Mr. Udwezi if you want to. I'll call Mr. Ngoti, let me correct that. I'll call Mr. Ngoti to come here and say 1 or 2 words on the last 3 comments.
That is not necessarily home, okay? I wanted to react to the comment from the prisons. Or why are we not only including other Banaba Saturday Sukol again? It's like as alluded by the previous speakers. This challenges they will need multi-sectoral support and coordination again. Because hardly will our system, how are as almost follow our fail again. For small ministry, wa youth, wa gender, banana day. So some of these challenges, the battle ministry warona, kind of government as a whole, or twarahante diatla and resources so that research could be possible again. Because if for people say yeah GSH level bana ba mo school, or how do we, since majority have an school, how do we equip them with the skills that they can to support? So it's about the support there and the resources from government as a whole. The other is my sister from health was simply answering I think that is all that I wanted to just clear. Galabo.
Now I'll call Bikuzo Gengesha. Kind apology if I have said your surname in the wrong way. Mr. Bikuzo, you're welcome.
Well, thank you so very much, Madam Director, did I say Madam Director? Director of Ceremonies, for inviting me over here to pretty much summarize or deduce some of the way forward or action items that we need to act upon as Botswana or as Botswana. One, there was an issue of protective factors to say that we ought to and we need to resuscitate what we used to call parent-child communication. Very, very important. We ought to be vigilant all the time to ensure that we know where our children are and we also know their problems. Because the study pretty much revealed quite shocking statistics with regard to those elements. Most of the time we don't know where our children are. There is also a call, that is the second point, there is also a call for further research to say that now that we have the qualitative results or study, what else should we do to establish the whys? That is, did I say qualitative? Qualitative study. We need to know why, right? To further understand the health enhancing factors, what is it that contributed to we need to establish they fuel or they propel not so good health amongst our learners. The use of alcohol, the use of tobacco and others. So we need to dig deeper into that. And that speaks to all of us here, the research institutions, to say, let us assist the government unto working mo go tsone. Implementing the global standards for health promoting school. Global standards for health promoting school. There is an initiative by the World Health Organization and UNESCO to ensure that our learners are in a good state of health and they are able to produce good results. So this initiative was started in 2022. And Botswana was amongst the 5 countries which adopted these standards. We are amongst countries such as your Kenya, your India, and others. So we started off with 3 schools, that is Botaka, we started with Mopato and Mahupu Kotakatokwani. But we made efforts to roll out to other schools. As we speak, we have about 8 schools which are implementing these standards. And Relimpi talked about such a good initiative that we need to now roll it out to the entire country so that the findings which are put before us, they are addressed, ladies and gentlemen. So I've decided to put it here to say to all of us here that let us strengthen the implementation of the Global Standards for Health Promoting School initiative. There is also a call for capacity building to say for us to do away with these challenges that we are facing, we need to capacitate ourselves. The implementers ought to be at par with us, the policymakers. There was once training of food handlers, and my teacher from Botswana, she's saying to us, let us go back to our schools and ensure that we capacitate food handlers. And like I said, that speaks to all of us, be it local government and traditional affairs, health and education, reassuring we do such. Resuscitate clubs in schools. It's a very important statement that we shouldn't take light. Learners need to be engaged all the time. And I'm very certain that if we can engage our learners through these clubs, be it school health clubs, your 4Bs, whichever club, our kids to and think about other things. We all know that learners are naughty by nature, with boredom, by exhibit a not so good health. Yeah. Am I speaking to someone? Beautiful. With regard to the survey, the technical working group is working towards finalizing the dissemination plan. To say now that we have disseminated nationally, what are we saying about our regions? What are we saying about our schools, where we got this data? Shouldn't they know the results is on it? And it is upon us to ensure that we reach out to them, speak to these results, make sure that we have action-driven, did I say action? Evidence-driven activities or interventions. Work with them to have such kind of interventions in their schools. And we are also here emphasizing that UNESCO and WHO kindly work with us, Botswana, to ensure that this survey is conducted each and every 5 years. The last time we conducted this survey was in 2005. So it's almost 20 years. So we need to ensure that we align to WHO's expectations. As I conclude, ladies and gentlemen, my brother from Anti-Tobacco Network, he emphasized on tobacco to say we have learners who would want to stop smoking or using cigarettes or tobacco. So it is upon us here to ensure that services are provided to our learners, not only learners but to our youth. As I conclude, Madam Director of Ceremonies, there was emphasis on collaboration to say we need to work together. And in summation, one can say that 2 heads are better than one. One roof, one head cannot carry a roof. Chinyoni babili mkomba ugachouluka. Wae sekaweli. The tripartite ministries in conjunction with UNESCO and WHO, and one would then also say, he who urinates alone cannot feel a stream. And lastly, this is school health program in action. Sound policies we have. But if we can implement these policies, health, education, and the camaraderie can also prevail in our schools. Thank you so very much.